Hi, it's Dr. Robert Brueck. I'd like to make some general comments to you about a very common operation that we perform called breast reduction. Breast reduction is an operation that we take a large pendulous breast and we make it smaller. So breast reduction, as opposed to a mastopexy, will include reduction of breast volume as well as skin. Now, as you can well imagine, some women have enormous breasts. They might be 48 quadruple D and everything in between. Some women might be a 38D, but again, would like to have their breasts made smaller. Now, in a breast reduction, there are really two aspects to breast reduction surgery. One is to eliminate physical ailments. In other words, many women that come in to see me for breast reduction have got significant neck, back, and shoulder pain as a result of their breast being large, pendulous, and hanging. And this creates a tremendous amount of wear and tear on their cervical spine and their back, especially when you carry these around for 10, 20, 30, 40 years. I can't tell you how many times women of Medicare age will come in and say, oh my gosh, I wish I could have done this 30 years ago. I didn't know insurance would cover it. On occasion it will, but many times insurance doesn't pay a reasonable rate for a breast reduction surgery. But there's no question the performance of breast reduction has enhanced the lives of many individuals because you take that heavy weight, that burden off of their shoulders and make it more plausible for them to enjoy golf and enjoy gardening, enjoy their day-to-day living. So breast reduction is a great procedure. And again, it's important to understand that the volume of breast tissue removed can be significant. I did one lady from Palm Beach where I took out maybe 10, 12 pounds of breast tissue, about 5, 6 pounds from each breast. And this greatly enhanced her day-to-day living, as you can imagine. Many times we do breast reduction surgery. It may not be significant in terms of volume, but yet it's enough to cause that individual to have a healthier lifestyle. And it's important to understand when you do breast reduction surgery, the breast is very sensitive to weight gain and loss. Many times women will come in and tell me, I put on 5 pounds, it goes right to my breast, or I put on 5 pounds, it goes to my buttock. I lose 10 pounds, I lose it from my breast. And so your breasts are very, very sensitive to weight gain and loss. So I would encourage you to consider getting close to your ideal weight before you contemplate having breast reduction surgery. Now, the operation itself is one that we do as an outpatient. It takes about 2.5, 3 hours to do. Most patients will bring a sports bra with them, and that's what they go home in. And again, like I tell all my patients, when you go home, you go to bed. You can sometimes put a little Ziploc bag with some ice and pretty much sleep and don't do anything. Don't do any heavy lifting. I tell people, because sometimes people don't have common sense, I say you don't have a breast reduction on Friday and then Saturday morning get up and vacuum or wash your car or windows or whatever. So for 4 or 5 days, lay low. After 5 days, let comfort be your guide. You can usually take a shower in a day or two, blow dry with a hair dryer, put a gauze or a washcloth over your breast, put your bra on, and lay low. After 5 days, let comfort be your guide. So if you're 5 or 6 days post-op and you're doing something like lifting something or doing house cleaning activity or any kind of activity and it's uncomfortable, don't do it. Real physical activity, golf, tennis, aerobics, probably 4 or 5 weeks, and pretty much after that period of time you can pretty much resume normal activities and do whatever you want. After the stitches come out, most of them come out in about 8 to 10 days. People can then use scar creams to go ahead and manage the scars. And it's important to understand, generally speaking, any scar on your body from whatever procedure you had done will take time to mature. Now, that maturation phase of scar healing can take 6 months, 3 months, a year, or more. So it's important to understand that scars do take time to mature. But again, a breast reduction is a great operation. Risks include asymmetry, scarring, infection, bleeding, loss of nipple sensation, loss of a nipple. Very uncommon, but it can occur. And again, I might add that any kind of breast surgery, reduction, mastopexy, in smokers is fraught with complications. I tell all of my patients that are having any type of procedure, quit smoking 2 weeks before. because the wound healing complications with smoking are magnifying probably 10 times. So it certainly would behoove you to quit smoking before you undergo any operation, whether it's a breast reduction, a breast lift. Certainly if I do a breast lift with augmentation, I demand that people quit smoking. I don't do them at the same time. I split them up just for the patient's safety. So breast reduction is a great procedure. It can really enhance your lifestyle in terms of getting you out to be more active, feel more comfortable, and doing physical activities. Again, it takes about 3 hours to do. You're asleep, so you don't feel any pain, and the recovery is pretty straightforward. So again, if you have interest or questions, feel free to come in, or you can call my office at any time, 239-244-2329.